We're back now with clinical and forensic psychologist Dr. Judy Ho. And Judy, we cover many stories of survival on this show. Is there a common character trait among them?
Mindset is almost everything. And in fact, one of the most important traits that they share is this concept of resilience. So being able to bounce back from life's challenges and moving forward positively. Part of that is not taking the victim's role so that that's not their identity, so they can be empowered to help others to go through this experience as well. And here's what we know about marijuana. Marijuana can lead to psychosis in some people, but it is not linked to violence. In fact, it has an inverse relationship to violence. And so in this individual, even though there was possibly a psychosis that might have been partially set off by the marijuana, we do not find that link to violence whatsoever.
And our parents are supposed to be people that love us and that care for us and show us a model of unconditional love. Instead, his father showed him terror and fear. I think Michael is a textbook case for why childhood is really the most important thing in our adult trajectory. In his mind, he was a child.
I'd like to introduce a friend of ours. She's a psychologist and an expert in the field of human behavior and compatibility, Dr. Judy Ho.
We brought in Dr. Judy to observe and identify who they are at their core.
Part of the issue is that she doesn't realize that pain is just another feeling that goes away. But she's afraid of it, so she's done a lot of things to try to protect herself from it. So there's a wall
Take
up.
a poll, and when you look at the research, there are these beliefs that a man should never hit back, but a woman can hit if she gets upset. So we have a problem here of the double standard. We have a problem of the underreporting, and I completely agree that nobody should be hitting anybody. Unfortunately, the word provoked makes it sound like that the female had it coming, that she somehow deserved it. And so, of course, that poor choice of words is why we're having this discussion. And maybe celebrities are not primed on this, that with all of that good attention, you're going to get some of the negative attention too, because somebody's going to look at you just like you were saying, you know, I don't like this person because they have some things and I'm envious, I'm jealous. Women are targeted more than men, and also the perpetrators are also mostly women. The manipulation is so deep that Susan must have been convinced that Bill was completely in love with her and that they were going to build a life together for the rest of their lives. Bill apparently told her that he didn't want anybody to find out that they were living together because he was afraid of what the other teachers might think. She had a motive. Her motive was to get rid of the woman who was threatening to ruin her relationship with Bill. I know why Trump is still popular no matter what. It doesn't matter
wait.
what he
You know
says.
why?
I believe I know
Let's
why.
hear this. We've been asking this question for 2 weeks.
I think it's what everybody knows in their heart because he's a celebrity. Nobody wants to shut off the Donald Trump show, no matter what. Nobody wants to cancel his show. It's like the best reality TV ever. Now everybody cares about the election.
But they also have a mental health issue, and it's really important to say that.
I think we have to be careful, though, about what we identify as a mental health issue, because there's already a lot of stigma out there about the mentally ill and thinking that they're all dangerous. That is just absolutely not true. 99.5% of them are not dangerous.
But that's not what we're saying. But
for you to say that it's a mental health issue and not clarifying that this is not just something that you diagnose as depression or anxiety. Sometimes parents are wanting to shy away from actually putting boundaries on their teens. They want to be seen as the good parent, the supportive parent. They may not see this as the same thing, but actually the most supportive parent is a parent that really puts their boundaries in place for the teen. Parents just have to not be afraid of the difficult questions, and if they see something alarming, ask that teen directly, what did you mean by this? I saw this on your social media. Tell me why you put this comment down. There is no pattern to when people come forward when they have been sexually assaulted. And in fact, there's a lot of delayed reporting or almost no reporting because there's so much of a stigma against people who do report. When you see something like this, you watch for behavioral patterns. And there's just a lot of patterns here, a lot of similarities amongst the alleged victims. So I know part of why you're here is you're trying to deal with this whole breakup.
Yeah.
So tell me a little bit about your girlfriend.
So yeah, when we split, it caught me completely off guard.
Men tend to be singularly focused, and male brains like to find solutions to problems. When you think about it in the context of a breakup, they can't get their minds off of it, and they're trying to find a solution to the problem, but there is no solution because the breakup's already happened. So those two things combined that are inherent in a male's biology is what makes it harder for men to get over a relationship. You can actually feel better in this moment just by focusing on what's going on right now, because what's going on right now has nothing to do with your breakup.
Right.
It's just us hanging out right now and having a conversation.
Boom.
Right?
I'm getting him out of here.
Okay.
And I'll
okay,
put
get
my
him
head
out of
back
here.
in.
Chris, I can't wait
Appreciate
to
it.
see what you guys do for the next few days.